Welcome to Therapy Facts with Dr. Jenn. Today we are talking about adjuncts or alternatives to professional psychotherapy. So, there are things that can be done, including point number 2, which is journaling. Journaling is one strategy that can be done as a substitute for therapy if one cannot afford to go to therapy or does not have the time to go to therapy, or journaling can be done as an adjunct to professional psychotherapy. As a therapist, I use journaling as homework assignments where I have clients to take pen to paper, and typically the paper, I ask them to put it in a spiral notebook that they can or get from their children's stash of school supplies, or they can go to the Dollar Tree, or they can go to Walmart and get $1 or $2 bound spiral notebook or bound notebook in order to keep the pages together. But very specifically, the instructions are to put pen to paper because the research shows that the experience or the benefit of journaling is enhanced and most likely to be experienced from putting pen to paper. When the pen is put to the paper, the person is writing about how they feel, what they dreamed, what concerns them. I, particularly as a therapist, love to get people to write dear so-and-so letters, dear mom letters, dear dad, dear husband, dear ex-husband, dear child, dear football, dear basketball, dear cooking, whatever topic that the client brings to bear that is of great concern and they have little awareness about, I ask them to put pen to paper to journal. Now, for people who are not in psychotherapy, you can do the exact same thing. You can take those topics and you can begin to write about them. The great thing about journaling is you only need about 5 minutes a day. You don't have to spend or set aside hours and hours each day to write. It's more about the consistency. It's more about being able to track your thoughts and your feelings from day to day than it is about a great depth of writing. Because eventually, the little bit of writing that you do from day to day is going to present itself, it's going to present the depth. You will be able to take the position of the man or the woman in the mirror. You will be able to write to the man or the woman in the mirror. Now, if you are doing this on your own, it may take you a little while to get to an understanding or a better understanding of your thought processes and or what makes you tick and or what makes you concerned. However, if you are also in professional psychotherapy and you decide to share your details with your therapist, then you will be helped to come to a better understanding about what you're writing more quickly. However, this is not a marathon. Sorry, it is a marathon. It is not a sprint. So if you are someone who cannot or does not want to go to therapy, then go ahead and journal and don't worry about going quickly in terms of being able to understand what's going on with yourself. Just be consistent in your writing and you're reading it back to yourself, and be courageous to be very, very honest with yourself. And that's whether you're going to therapy or not. Now, even though I give the homework for clients to journal, I don't necessarily require them to share their journaling in therapy, the actual details of the journaling in therapy, because I want them to feel free to be super honest with themselves without having to worry about sharing with me, about having to worry about what I might say or how I might respond. However, as therapy commences and they get a better understanding, then very often we do talk about maybe not the details, but we do talk about the things that they're learning about the various topics that they are journaling about and the things that they're learning about themselves that they are journaling about. So, again, journaling is a very powerful and a very inexpensive alternative to therapy if you are not in therapy, and it's a very powerful adjunct to therapy if you are. So, get a notebook and get to writing.